Hey guys, Jessica here. So today, let's use some of our pump science to dig into determining if the information that durable medical companies or manufacturers give to us is always accurate and always represented in a way that anybody viewing the data would agree with. And also to see if this graphene pressure meter can sometimes explain things that moms are reporting with pumps that we wouldn't necessarily know. This is not the same as this. When you change a pump but you don't change the name, that's really frustrating for consumers and it's frustrating for lactation consultants because now we're like, well, oh, you're using this pump? Well, which version of this pump are you using? And you have to be aware this is not the only pump this has happened with. There are multiple pumps right now where if I'm investigating something with a client, I have to ask a lot of follow-on questions to figure out exactly which pump they're operating and what those settings would mean in terms of, are we using efficient settings? Do we need to optimize something? Do we need to change something? It kind of puts consumers at a disadvantage because you're trying to purchase products based on what previous reviews have said. And it puts lactation consultants at a disadvantage because we don't necessarily know the changes. Like I said, I had a company reach out and tell me that this was a significantly better pump, and I was going to be so pleased. But in my opinion, this was the better pump. This is a downgrade for me. I would no longer necessarily recommend this for somebody who needs that faster, more reliable cycle speed in order to have a portable pump. I'm a little concerned that the quality changed. Again, when we talk about higher quality motors tend to be able to sustain faster speeds. Why you would reduce speed if you're not reducing the motor quality, I don't know, because that goes against, pump science and what we know is working and what consumers want. So I have to assume that there's a quality issue. And then if there's a quality issue, I have to question, well, how long is it going to last? So is this a bad pump? No, it's not a bad pump, but it's not this pump. And that's where pump science is going to become increasingly important when you're talking the number of new breast pumps. Right now, I am currently watching 5 pumps that are about to hit the market. 3 of them we don't know anything about. One of them has the same name as another pump, and it may be an upgrade, it may not. When you call it the same name, people assume it's the same thing. And that is where we really need this independent third party data. And I really wish that they would give it to us with the pumps. I'm happy to graph them and figure this out for us, but I feel like this information should already be there. The manufacturers should be telling us what their product does because these are medical devices. And when you're trying to purchase a medical device, you're kind of at a disadvantage right now with the current system because the manufacturers are talking to the medical companies who, I'm so glad that we have durable medical companies now because I do have moms who can get a breast pump get a good breast pump at no out of pocket costs. Breast pumps are hundreds of dollars often. I love that we've got this option, but it also places another hand in the pot for the consumer's money. And that kind of puts us at a disadvantage if the manufacturer and the durable medical companies are the ones controlling the information currently. And then we just have to figure out how to make it work. That's not really good for moms. It's not good for breast pumps. This is how companies are able to kick out so many low cost, low efficiency, not so great pumps is they're not having to disclose this information. I mean, can you imagine buying a car that didn't tell you what the engine was? You just don't know. You buy it based on its looks and the promise that, that Ford Mustang was real good. But if you think you're buying a Ford Mustang and what you get is a Dodge Grand Caravan, you may not be very happy with that because those are not the same thing. It's not that either is a bad choice, it's that they're not the same thing. And that's where we're at with breast pumps. We have a lot of pumps out there that are using the name of a previous pump, and it's to their advantage. These were typically pumps that we liked. If they were pumps that people really didn't like, they just kind of disappear from the shelves. You can see that with some of the Amita line, where there's been, like 6 different versions of the Amita Maya Joy with that name. And if they weren't really popular, they just, ceased production and moved on to the next one. Great. But when you call it the same thing, consumers are relying on that information. So we're going to dig a lot more into these. But here's a great example of, the promise was that this is better. And moms knew it really wasn't better. But we don't have a lot of people who use multiple generations of a pump because a lot of people only have one or two babies now, and they may have them close together, so their pump may last. But we need to know this information. And for one, I'm really glad that we can explain what's going on with these pumps. And I'm glad that breast pump science is allowing us to help figure out what's happening and will hopefully help us figure out how to tell before you spend your money. Because I would love to be able to actually tell you what pumps are worth buying with reliable evidence-based information, not just, well, we've had a lot of luck with this one. I think we can do better than that. So we're going to continue doing this, and I hope you enjoyed kind of seeing how breast pump science works to help us figure out what these pumps are doing.